Welcome to the Action for ME Annual General Meeting for 2022. For those of you who don't know me, I'm Roger Siddle, Chair of the Board of Trustees. I want to welcome you all to this and to give a brief introduction to our session. I think it's important to recognise that post-lockdown, life continues to be very challenging for disabled people and for those living with long-term conditions like ME. And as diagnoses of ME increase following long COVID, so too has demand for our services increased. I suppose in some ways, though, the good news is we have been able to increase our funding this year. That means we have been able to do more this year, which you will hear about today. You'll also hear about our role in some of the more significant events for the ME community this year. And you'll also hear about our ambitious plans for the future. So just some words on housekeeping before we get going. We're now holding our AGM online because it means it's accessible to many more people. It is being recorded, and so those unable to attend can watch later through our website and social media. Only those presenting will be visible in the film. There will be an opportunity to ask questions of our panelists, which we will answer at the end of the session. Please use the Q&A function on your screens at the bottom to type your question. I'd like to welcome all of our trustees. I'd also like to welcome anyone who's watching now or watching later. Of formal note, the minutes of the meeting are being taken by Ruth Richardson, Director of Business Support and Development. And a few more observations on our trustees. First of all, welcome to our new trustees who joined our board at the merger with the ME Trust, Rollo Hope, Julianne Devine and Philip Courtney. They will serve their remaining duration as trustees from the ME Trust and then, as appropriate, stand for re-election with Action for ME. We also welcome Dr. Nirmala Santiapillai as a new trustee standing for election, who will bring significant experience and expertise to our research activities. Lucy Goodwill has decided not to stand for re-election as a trustee, and we therefore thank Lucy for her contribution and we look forward to her continued engagement with the charity. And there are two trustees who are standing for re-election, one of whom is myself. So just to make sure I can continue in this role for the meeting, I'm now going to hand over to Sonia, our Chief Executive, for the results of the election of trustees voted. Sonia.
Thank you, Roger, and thank you to everybody that sent in your votes. So for Sue Hardy, we had 21 votes for yes, 0 for no, and 2 with no preference. Roger, I'm delighted to say that we can confirm you as chair with 21 yes, no no's and 2 no preference. And for Dr. Nirmala Santiapillai, 18 yes, 0 no and 5 no preference.
Great, thank you, Sonia. So all of those trustees, including myself, confirmed in their position going forwards. So I will now chair the rest of the meeting. Move on, the minutes of the last meeting, they have been circulated to all registered participants with joining instructions. As ever, it's a long time ago. If anybody has any matters of accuracy or amendments required, then please do put a message through the chat function. I'll give that a minute or so for Claire to indicate to me whether anything has come through. No, okay. I'm going to formally resolve that the presented draft minutes are taken as an accurate record of the meeting held in October 2021. And now this year, I am very pleased that Sonia is able to be with us, and I'll hand over to Sonia for the Chief Executive report for 2021-22.
Thank you, Roger. It's always really odd to talk about the year that finished at the end of March this year, because obviously we're several months beyond that. So this year we're going to focus much more on the work that we're doing now and years ahead. However, just as a brief summary of our last financial year, as Roger said, it's a very difficult year for everybody, our colleagues, our volunteers, and the people that we're here to serve. And that did have quite an impact in terms of our services, and we did endure waiting lists, which is very disappointing for everybody, and that was despite us putting in extra resource. We know that we've seen an increase with the numbers of people who have long COVID with overlapping symptoms of ME, and we are continuing to see people that have been subsequently diagnosed with ME. So I'm going to give you a few facts and figures. All of these can be found in the annual report. So if you have time and energy, please do take a look. And I've just picked out a few top ones. Our information and support services are open Monday to Friday, and they provide help via telephones and email. And Claire will say a bit more about that in due course. Last year, they responded to 1,560 contacts, and the resources that we make available on our website and also that we post out, because we know not everybody is able to be online, were accessed 33 times, downloaded 33 times per working day. We provided lots of information around the COVID vaccine, including a template letter for doctors. And our advocacy service worked with over 240 people. Now, that may not sound a lot, but we're quite a small team. And actually what we have seen over the last couple of years is that the level of need and issues that people come to us with are much, much more complex. And we have made a decision to make sure that we are there with those individuals for as long as they need us to be to provide advocacy. And that did result in waiting lists. But what we're finding is that often the people we're supporting are the most severely affected. We continued our work with children, young people and families, including our Breaking Isolation Young People's Forums. We have young people that send out birthday cards to each other, so no young person is without a birthday card on their birthday, because we know that people are often socially isolated, not in school and not being able to do all the things that their peers are, and also receiving our Cheers magazine. We were delighted in February this year to merge with the ME Trust and to launch our new healthcare services. And you'll hear more about that from Helen in due course. But in February and March this year, we supported 170 people through our holistic healthcare services, which includes GPs, physios, multi-faith chaplains and counsellors. We've continued to support our supporting members, receiving our Interaction magazine, and I just want to say a huge thank you to all the volunteers that input in recording the audio version, proofreading and writing articles for us. Ruth will tell you a little bit more about the continuing professional development work that we do in Scotland in partnership with others. But last year we supported over 600 health professionals to access our CPD, continuing professional development modules, and they reported an 88% increase in confidence as a result of that. Many of you will have inputted into our Act for ME programme, and you'll hear a bit more about that in a moment. And obviously there was a huge amount of work that went into leading up to the 12th of May, when we had the announcement from the then Secretary of State about the National ME Delivery Plan. And again, we're going to tell you a little bit more about that afterwards. I just want to finish by talking about our research work. Obviously, we launched Decode ME last week, and we've been delighted with the response there. And the work that went into to being able to launch that was phenomenal. And alongside that, we were also funded to deliver the priority setting partnership. And I just wanted to give you a few statistics from that. We had a fantastic steering group of people with ME, carers and healthcare professionals. We issued our first survey and we had 1,560 responses, which generated 5,300 ideas for research. From that, 59 summary research questions were developed, and we went back out to people with ME and others, and 1,750 people helped us to reduce that number down and to 18 questions which were shortlisted. We then held 3 workshops with 36 people with ME, carers and healthcare professionals, including those who are severely affected and their proxies. And we were delighted to launch the top 10 plus priorities, and that will help shape our research work going forward. Those facts and figures are interesting. They give you a flavour of our work. You can read more in our annual report. But actually what it's all about is the impact. All of our work is aimed to make a difference for people with ME, and we know it's not enough. We know that people are frustrated. We are frustrated that we are not having the speed of delivery and development that we want to see. However, we still need to make sure that we're here for people with ME when they need us, and we will continue to do that as we continue our work with our new strategy. Thank you.
Thank you, Sonia. As a reminder to all attendees, if questions occur along the way, please do type them into the Q&A function. We will pick up at the end. I'm now going to hand it over to Jonathan Manuel, our treasurer, who took over as treasurer for Philip Marsden last year, to take you through the treasurer's report for 2021 and 22. Jonathan, over to you.
Thanks, Roger. I can't open my video for some reason, so apologies for that. But if we can, and I can't see the slides, but apart from that, if we can move forward, there we are. Hang on a second, something's happening here. I can't see the slide, but if you can see the first slide, which is our incoming resources, is that the slide coming up? 1 second, I can see some movement. Apologies for the delay. Yeah, slide number 3, I think we were there. There we go, fantastic, thank you. So as you can see, a very impressive 2.5 million income, which, as you know, if you've seen some of the previous communications, thanks to an excellent legacy, very generous legacy of 1.3 million has pushed our income up significantly. But obviously that also says that compared to 2021, we've held our other income in line, which is great. So, and obviously dominated by voluntary income, as you can see on the slide there. The other amounts that you can see in terms of charitable activities and other are very much covered by the likes of subscriptions, lotteries, Christmas cards, that type of thing. But obviously the dominance is voluntary income. If we could move on to the next slide. And there again, you can see in terms of our overall income, but apart from the legacy, you can see the strong performance in terms of money coming in from donations and trusts. And we have various other forms of income as well. But as you can see, voluntary income very much through that legacy income, which has given us a very strong performance of 2.3 million. But with other pieces and a lot of hard work, as we know, goes into all of the other donations and trusts and all the activity that brings the income in, that it enables us to do the work we need to do. So, and that gives you the breakdown. So if we could move forward to next slide. Okay, so in terms of our expenditure, then we've got 1.3 million of expenditure, which again is ahead of last year, but partly because of what we're trying to do is obviously to invest in charitable activity, and you can see the vast majority of that spend is of course in charitable activity, and I think there's a breakdown coming on that, and then we have a very small amount on fundraising, trading. And then we have, apart from that, obviously there are costs associated with generating that voluntary income that you saw on the previous slide in terms of the investment we need to make. So let's have a look, I think, a bit further at the charitable activities. Perhaps you could move to the next slide, please. There we go. And so of that 1.1 million, you can see that we are investing in information and lots of different types of information in terms of one-to-one information support and advocacy services, peer support to adults, etc. So a lot of work going into information and services, and clearly a lot of campaigning. You'll have seen a lot of the and I think Sonia's already referred to it in terms of some of the work that's going on around campaigning and influencing, and research, and that's where all of our expenditure is focused in terms of trying to deliver the services for Action for ME. Okay, and if we move on to the I think is the final slide. So again, that that legacy really drives for us a significant increase in our accumulated funds. But of course, we don't want to just sit on that. That wouldn't be much of much help. So as you can see, a significant chunk, 1.1 million, is designated, and the vast majority of that is designated to invest in research and invest in new activity that will enable us to progress the work of Action for ME. So a bit of a whistle-stop tour, but hopefully gives you a flavour of a very strong year that enables us to really invest for the future, invest to sort of drive forward the agenda of Action for ME, and suffice to say, thanks to everybody who contributed, particularly to every single penny of donation income and other income that really helps us do our work. It's great to get such a large legacy, but those are by definition one-offs, and it's that ongoing income that really enables us to have the platform to then invest when we are fortunate to get such a sum of money. So quick tour. Thank you very much.
Thank you, Jonathan. My camera to reappear. Thanks, Jonathan. That is a very whistle-stop tour of the year just gone. We're now going to move on to look at where we go from here. A year ago, the trustees hesitated about setting a strategy in the future for the charity going forward because of the considerable uncertainty in the world around us at that time. We now feel more confident about setting our direction for the next 5 years. And there now follows a set of presentations around the pillars of our ambition around the national strategy for ME set by the UK government, around the services that we provide in terms of information, support and advocacy, and now healthcare, and our increasing attention to high quality research by more researchers leading to effective treatments for ME. And these presentations will be given by Sonia, by Claire and by Helen, and I'll hand it over to Sonia to lead off.
So we were delighted on the 12th of May, which was the first World ME Day, that the World ME Alliance launched along with all of our partners and colleagues. We were delighted that the then Secretary of State, Sajid Javid, announced that the UK government needed to do more for ME, he acknowledged that people with ME had been left without the support, the care and the research that was needed to ensure that things are different and that change follows. And his solution to that was to ask his colleagues in the Department of Health and Social Care to work with the ME community and others to develop a national delivery plan for ME. So for many of us, that was a very emotional moment. But the question is, so what? What's going to change as a result of that? I don't know those answers at the moment. That plan is being developed as we speak. But I do know that there are many, many of us that are involved in helping shape that. And once a draft has been developed, it will come out for full consultation, which I think is hugely important, that everybody has an opportunity to have a say. We know what the difficulties are. We know what the issues are. Many watching will have been experiencing those for months, years, and maybe even decades. What we now need to see is to see real action and real change. It won't come as quickly as any of us want, but we have to ensure that there is something that is going to be different as a result of this work. Lots and lots of effort went into that moment, and I do just want to acknowledge the civil servants working in the Department of Health and Social Care and all the others that helped make that happen. As we know, our political world at the moment, particularly here in the UK, has been turbulent and a bit up and down, I guess. And so they have worked tirelessly in the background to make sure that the ME delivery plan did not slip off the agenda. I think it's also sadly helped in a way with long COVID. It's helped to shine a light on post-viral diseases like ME. And I mentioned earlier about the overlaps that we're seeing for some people with long COVID. We've seen a growth in press and media. Part of that was driven by Action for ME and our work, and we commissioned an agency called Connect, a public affairs and communications agency, to help us with that. And we have had a series of meetings with politicians and others. And we always do that through Forward ME, in consultation with others. The work we're doing in Scotland, there are lots of conversations about who's speaking to whom, etc. It's really important that we don't inadvertently step on each other's toes. Since the announcement on the 12th of May, there has been a governance framework set up. There is a task and finish group, which myself and others are on. All of the groups that have been set up to help develop this draft delivery plan have co-chairs who are people with lived experience of ME. And I think that's a really important and positive step. And each group has people with lived experience on them, alongside professionals working in the field, the charities and others. This level of inclusion, I think, is unprecedented. So under the task and finish group, which has a responsibility to oversee the development of the delivery plan, there is a research subgroup, a living with ME subgroup, which looks at a whole range of things from social care and other sort of aspects of living with ME. An attitudes and education group, which I think is hugely important given the level of stigma that people with ME have endured for years. And there is a group specifically looking at engagement. The delivery plan is due to be launched later on this year. And that, as I said, that will go out for full consultation before being launched formally next year. We hope that there will be real change coming for people with ME, and we are pushing as hard as we can alongside the others that we are working with to ensure that that happens. We don't need any more rhetoric, we need action. So I just want to finish off by also saying that there is a huge amount of work that sits under this, and whilst there may be myself and others that are involved in those meetings, the whole team in Action for ME, the trustees and our volunteers are inputting into that. But we also rely on the voices and experiences that we hear from you through social media, through our surveys and also through our services. Those voices and experiences really help shape what we say within those meetings. So please do continue to share your views with us. And when the draft plan comes out for consultation, we will be considering how best to engage that and help gather views to put forward. So really, really exciting development, but we need to see the detail before we start jumping up and down with real excitement for this. But do know that Action for ME is pushing for real change. Thank you.
Thank you, Sonia. I'm going to talk now about one of our other strategy ambitions, which is that the lives of people with ME are improved by effective access to the information, support and advocacy they need. We set out 4 key ways that we'll do this, and I'm going to say a little bit about each one, what we're doing already and what we want to do next. We've said we'll grow our support services to reach more children and adults with ME and their families. So this is a current map of our range of free services. Our information and support team, there on the left, is where most people begin, and they're already seeing a significant increase in the amount of time they spend on the phone and in email exchanges with clients, because the challenges those clients are facing are becoming more complex and take longer to unpick. We're undertaking reviews of our services to identify where we need to add more capacity or streamline our processes, or both, so that we can offer more one-to-one support. This will very likely include recruiting more brilliant volunteers for our Listen to ME helpline, which launched in May, and offers a safe space for anyone affected by ME to share how they're feeling. We'll also look at how we can reach more people affected by ME through groups and workshops. including developing a peer support network for parents of young people with ME, and seeking funding to continue peer support workshops for children and young people, currently funded by Children in Need, and that funding ends next year. Our aim will always be to be led by our clients, working at their pace, and share information and support in a way that works for them. We've said that we will increase our reach to currently underserved communities, with a specific focus on people from Black and other minority ethnic groups and those with more severe ME. We'll be led by the needs of these communities and their insight and input, building an experience of things like Decode ME, which Sonia's already mentioned. This project has had people with experience of severe and very severe ME on its steering group from the beginning, to ensure every aspect of the project is as accessible as it can be. To increase our reach to people with ME from Black and other minority ethnic groups, we'll use existing evidence about best practice and work in partnership with those communities to understand the barriers they face in accessing our services and support, and what we need to do to address those barriers. We've also said that we'll address the isolation and loneliness of people with ME. This will mean building on our existing range of peer support services for people of all ages. One of those is our ME Friends online forum, which is what that feedback on the slide is about. Following a survey of users, we're now thinking about how we can improve the functionality of the forum to make it more accessible and user-friendly, especially for new users. For the young people we support, our brilliant peer support moderators, all volunteers, have started to lead some drop-in sessions on their forum with games and quizzes, which gives the young users an informal way to connect with each other alongside the usual chat. Finally, we've said that we'll address the ignorance and stigma around ME by providing resources to people with ME and education and healthcare professionals. With input from those that we're supporting, we'll review our information resources to ensure that they meet the need. We'll run more workshops, empowering people with ME to understand their rights and entitlements and to advocate for their needs, wants and wishes. That quote there is from someone who attended our self-advocacy workshop on housing last month, which, like all our workshops, is tailored to our audience and their needs. We also want to grow our links with professional networks, particularly through our advocacy service, so that other providers come to us for guidance about working with people with ME and are able to grow those professionals' knowledge base about supporting this client group. One of the ways we've already been increasing professionals' knowledge is via the Learn About ME project, working collaboratively with other charities, the ME Action Scotland, the ME Association and the 25% ME Group. The project aims to increase understanding and confidence of Scottish health and social care professionals in supporting their patients and clients with ME by promoting Dr. Nina Muirhead's online learning module alongside our new podcast. And there's some outcomes there on the slide. The target for downloads of the module was 500, but we've seen more than 8 times that, with 1 in 4 of these from Scotland. We've had 5 episodes of the podcast to date, and they've been downloaded nearly 2,000 times. We've got 2 more episodes coming up soon. The Scottish Government's been the only funder of this project, so activity has had to be focused on that nation. With further investment, we could roll out the project and build relationships with key stakeholders in Wales, Northern Ireland and England. I'm going to hand over to Helen now, who will talk about our ambition around improving access to healthcare.
Thank you, Claire. Thank you. So I'm going to talk about the second of our ambitions, which that we will improve the health of people via access to our holistic healthcare services, and also that we aim to get the national guideline that was issued last year effectively implemented across NHS services. So focusing first of all on what we are going to do ourselves as healthcare. As was said earlier, we have a team which includes a doctor, some physios, some multi-faith chaplains and counsellors. Our immediate aim over the next 2 or 3 years is to increase the number of doctor appointments. And we also want to increase access for counselling for adults. And to make both those things happening, we're actively recruiting both doctors and counsellors to our team. We are also planning a very exciting development which will focus on children and young people, 13 to 18-year-olds, for whom there is no counselling service out there that specifically targets people with ME of their age group. So we're very excited to be expanding our service in that direction. Next slide, please. We're also going to be exploring two very important areas. The first of these is a nursing service. We don't currently have a nurse in the team, but we have ideas and ambitions that will hopefully lead to a pilot scheme whereby nurses will be very much at the core of our future team and helping people with ME right from the beginning, from their first contact through information and support, all the way through and supporting them on their journey. A slightly longer term ambition is to provide some regional outpatient clinics. That will take some time, and that's something we're going to be exploring a little bit further down the line, but it is definitely on the priority list. Next slide, please. We also need to provide evidence that we need to provide these services in order for them to proceed. So we're gathering feedback, we're developing a framework for evaluating the impact and gathering data on unmet needs. And we need to very much show the benefit to provide evidence, evidence to funders and evidence potentially to the NHS about the model of a holistic healthcare service, which is very much at the heart of what we do. And I should just say at this point that holistic healthcare for us means we look at the whole person. We don't just look at symptoms. We look at somebody as an individual with specific needs that are both that are physical, that are mental, that are spiritual. So we want to look at the whole person. Hence, we adopt the team approach. Next slide, please. It's very important to us that as many people as possible can access our services. At the moment, we make a charge for those services so that we can actually pay the healthcare team that deliver them. However, we offer bursaries for people who find it hard to find the money to pay for them. At the moment, those bursaries are up to 50%. Our aim in the next year is to be able to offer 100% bursaries for people who are on benefits or are in other forms of financial need and otherwise would not be able to access our services. We will need to fundraise for this because it's not something that, because there is obviously a cost to delivering healthcare services, but it will become a priority for our fundraising team. Next slide, please. And I think we need to also go back to the original ambition, which had two parts. And the second part of that is making sure that the new NICE guideline is implemented as far as possible across the NHS. That's a very big task, and it's not something Action for ME can do alone. We're working with other charities, through Forward ME in particular, but also, as Sonia has mentioned, we're very much involved in the government delivery plan and in shaping that so that we can move forward so that all people, wherever they are in the United Kingdom, have access to properly managed holistic healthcare services that are specialist for people with ME. And that is a big ambition, but something we are going to be working towards, as I say, not alone, but also with other people. I would just like to say in closing that we have a brilliant team of people who are very committed to delivering healthcare and who have a lot of knowledge and a lot of empathy for people with ME. And we're delighted as a team to be part of Action for ME following the merger in February. Thank you.
Okay, so thank you, Helen. I'm just going to finish off by telling you a little bit about our research work. Earlier this year, we launched our Breakthrough ME strategy. For us, this is hugely ambitious. We know it is not enough, but it's as much as we can do at the moment, but we are always striving to try and do more. We're really keen to be able to deliver at least £2 million investment over the next few years, which is more than we have done in the past. We know it's only a starting point. We know the government are looking at research as part of the National ME Delivery Plan. But what we really want to do was to not wait for that. We need to start seeing things change from the bottom up, as well as a sort of top-down political approach. Next slide, please, Claire. So last week we held the Genetics Research Summit, which was held in Edinburgh at the Medical Research Council Human Genetics Unit, whom we have forged a partnership with, not just to deliver Decode ME alongside people with lived experience, but also to work together to launch a virtual genetics centre of excellence. We're still in the development stage. If you ask me what exactly does that look like, we don't know yet, because that's evolving. And at our summit last week, we were able to hear a range of presentations from individuals. And then we had workshops which looked at different aspects of the work that we want to take forward. But between us, we have 6 questions, which you can see on the screen. I'm not going to read all of them through, to help us, to help shape what we do and how we do it. We want to see more genetic researchers coming into the field, and we want to see more research for more high quality genetics research. All forms, of research are important. But from an Action for ME perspective, we are very much focused on the biomedical research, and we believe that the genetics is a strong starting point. And we've seen that with other disease areas, and it very much builds on the work that we're doing through Decode ME. But we're also really keen to see how we can work with others to develop the clinical research. We want to see diagnostics and we want to see treatments. We are really hopeful that what we're doing will help accelerate. We know it will not produce all the answers, but we're really keen to start working with others, bringing in the pharmaceutical companies and expanding the team of researchers that we're working with. Next slide, please, Claire. So as part of the Genetics Centre of Excellence, we want to invest in our future leaders. These are the PhD and postdoc students that are currently working in the ME field, doing their studies and hopefully staying in the ME disease area. What we've sadly seen with other PhD students is they cannot get funding. It's a real issue for PhD students, as well as it is for other researchers. So we want to work with those students to help create a pathway to kickstart their career. The Future Leaders Network have been meeting for a little while, and myself and Professor Chris Ponting from the Human Genetics Unit have met with them on a number of occasions. And we've listened to their ideas about what they want and what would help them with their career development. So in August, we held a summer school. We had 8 students that came along. 2 joined us through the night from Nevada, and the other 6 were in the room with us. And we spent 2 days with them, focusing on areas that they had highlighted, from the science to using social media to help aid the science. We had a fantastic presentation from Sian, one of the Decode ME and PSP, patient public involvement members, and about patient public involvement. And Professor Julia Newton joined us from Newcastle University for the first day to share her experiences, which the students found really inspiring. During those 2 days, the students were able to come up with a number of ideas about how they could help shape research going forward. And on the left picture, you will see Luke, one of the students that we are funding at King's College London, who's just started his PhD studentship there, talking to the attendees at the Research Summit last week. He closed the summit and shared some of the ideas that they've got and the hopes and the ambitions for ME research, which includes setting standards about what should be done and what shouldn't be done, and how they as a group can ensure that that's evident in their research, with patient public involvement at the very heart. And in the second picture, you can see the students there. We, alongside Luke, we have also announced funding for a student at Oxford University, and Inga is with Audrey at the moment, another of the future leaders who's based at Edinburgh University in Nevada at Incline Village, on an internship with Dr. Daniel Peterson and Simran Research. This is to give them a wider range of skills and development and insight into working internationally within research. Audrey's coming towards the end of her PhD studentship, and Inga is at the beginning. And we hope that that will get, as well as developing their skills, they can bring that back and share that with their colleagues. And already Joshua, who was our PhD student based at Edinburgh with Chris Ponting, has himself secured a postdoc fellowship at Harvard and starts there in the new year. And he has already linked me up with his boss to see whether we can offer internships over there with Harvard. So some really exciting ideas that are coming through that relationship. And we don't know what else is to come. We're working very closely with the students to help them shape and develop their network. Next slide, please, Claire. As I said, patient and public involvement has been at the very heart of Decode ME. And I have to say, if you haven't signed up already, you are over 16, you live in the UK, and you have a diagnosis of ME, please go to decodeme.org.uk and take part. We're asking people to complete a questionnaire. The amount of information and data that we're gathering from that is hugely invaluable for science. Some of those individuals will be invited to provide a DNA sample. Those that aren't, it doesn't mean that you don't have ME. It just means that for this specific study, we're using very tight criteria to enable the science to be undertaken in the way that it needs to. Your data that you give through the questionnaire is valuable. Any saliva samples that are provided as valuable are valuable. And if you can help us recruit, that is invaluable. We have Jenny Jacks, who you can see on the right hand of the screen, who's helped promote the study and has shared her lived experience. And as Chris Ponting says, you know, people with lived experience are the experts, not just in their own experience, but often the experts scientifically. And it's because it's their world, they have lived in it. And so we are going to ensure that any future research that Action for ME funds will have patient and public involvement at the very heart, in the way that you can hear Sian talk about on the recording of the summit presentation that she gave last week. We also are working to look at how we can support funding and research around the top 10 plus priorities that I mentioned earlier on. And I'm currently speaking with others to see if we can create a significant, reasonably significant pot to be able to help fund a group of researchers yet to be determined to be able to take forward one of those priorities to help shape the research questions with people with lived experience. We're also just recruited people with lived experience onto the partnership board to help shape the Genetics Centre of Excellence. Next slide, please, Claire. And just to finish, I just want to leave you with this slide for Decode ME with the website details on, so that you can take part, you can fill in the questionnaire. Some of you may be invited to provide a DNA sample, but most crucially, you can help us reach other people that aren't on social media, that we're not reaching offline through all the charities and our membership databases. Please do help us spread the word. Thank you.
Thanks, Sonia. Thanks, Claire. Thanks, Helen. I hope that the people listening are as excited about the opportunities to make a difference as we are going forwards. And hopefully that you'll find those pillars that we've laid out actually meet what you think are the priorities as well. It's now time to take questions. Sonia will actually be master of ceremonies for this, but again, please do submit your questions through the Q&A function, and we'll pick them up and answer them as they come through. Thanks very much. Do we have any questions, Claire, Sonia?
Not seeing any at the moment.
Give it a couple of minutes. Okay. No questions. Well, both for participants today and those watching on video later, if you do have questions, please do feel free to contact the team. We'll endeavour, excuse me, to do our best to answer all the questions that we receive. But I'm going to bring the meeting to a halt with some thank yous. First of all, actually, it's a thank you to Sonia for 10 years as Chief Executive of Action for ME, during which time she has actually put heart, soul, and everything else into working on behalf of people in the ME community, and has achieved a huge amount. And I think sometimes goes recognised, sometimes doesn't. But I thank you to Sonia for those efforts and for the efforts that I know will still be to come. Secondly, I want to say thank you to the whole Action for ME team. This has been a year of some pretty significant milestone events in the world of the ME community. Decode ME, the change in the NICE guidelines, the priority setting partnership, the announcement of the government's intention to actually do something. And people with Action for ME have been at the heart of a number of those things, as well as providing their traditional ongoing services. So I'd like to take the chance to recognise and thank them for their efforts. Frankly, I'd like to say thank you to everybody who has supported us, who has helped make these things possible. So thank you to that, and thank you finally to everybody for coming, and a reminder that you will be able to watch this again on our YouTube channel. Thank you very much. Call a halt to our AGM.